Hello, friends, and welcome to Weekly Witness, Texas Impact's weekly podcast designed to help mainstream Texans of faith understand the legislative process and help you engage with public policy in the great state of Texas. My name is Scott Atnip, your host and Texas Impact's Director of Public Witness, and today we're excited to welcome Diana Forrester, Director of Health Policy with Texans Care for Children. This is an important conversation this week because legislative leaders recently released their interim charges for the biennium, and it provides some opportunities to speak to the unacceptable state of health coverage in the state of Texas. Diana joins us to talk about that, the interim charges, and what Texans can do. And spoiler, there are some things you can do, but you can also use this as yet another reason to engage your congregation and community in the Texas Faith Votes campaign. I imagine healthcare will be one of the issues at the forefront of the conversation this election season. Learn more about that campaign and all of the ways you can connect with Texas Impact and other Texans of faith in this important civic engagement work at texasimpact.org. If you have questions about any of it, feel free to reach out at scott@texasimpact.org. So with that, I hope you enjoyed this week's conversation with Diana Forrester. Joining us for today's conversation is Diana Forrester, Director of Health Policy with Texans Care for Children. And Diana, we were looking at the text messages when we set this up. Apparently, it was like exactly a year ago today that we had a similar conversation talking about Medicaid unwinding. So I don't know if we should go ahead and pull the calendars out now and set this up for next May. That'll be the end of the legislative session. I assume something will happen. Sound like a plan?
Yeah, I'm sure we'll find something to talk about.
I'm sure next May we will have something to talk about. But we mentioned the Texas legislature, which will be meeting next year. And when most people think about the legislature, they think about those 140 days during legislative session. But there is important work going on now, right? Talk to us about the interim charges and why this part of the process is so important.
Yeah, I like to think of, the actual legislative session as kind of like the negotiations part of it. And then the interim is where the rubber hits the road. I mean, that's when we start implementing all of these laws they passed. And it's like where the real work it starts to really pick up quite a bit, because from the stakeholder standpoint, you want to be involved to ensure that, the individuals implementing the legislation often are very removed from what's happening downtown during session and all those conversations and kind of the intent behind a lot of those language choices that end up in the final bill. And so it's really our job in implementation to be a part of that, to share that knowledge, to make that transition from, actually, there was like a whole bunch of stakeholders that were involved in this process and the legislator wanted it for X reason, and like you need to check with them and make sure that's included when you implement this. So there's a ton of work that happens in their interim. This week was the first set of interim hearings on the Senate side, and so the Senate Health and Human Services Commission had a very long hearing this week, and the focus was really on health insurance. And so they wanted an overview of the landscape of health insurance in Texas. Who are the uninsured in our state? Like, who doesn't have access to healthcare right now or health insurance, and kind of like what are our existing health insurance options? And then like what could there be that we don't have right now? They focused a lot on that. Kind of these other kinds of coverage options that aren't full health insurance seems to be a focus for them as far as trying to impact the huge uninsured rate we have in the state.
Yeah, so talk to us about who are the uninsured in Texas now? What are you paying particular attention to?
Yeah, so one of our partners, Texas 2036, did kind of a 2-year study on this, and they did focus groups from around the state with people that were uninsured, meeting with them regularly and kind of having these conversations like, what are the barriers? Why don't you have insurance? What have you tried? What haven't you tried? And a big takeaway is it's working parents. They're kind of in that gap of where they don't qualify for subsidies on the marketplace and they don't qualify for Medicaid, but maybe their kids do and they just don't know about it. And so they are doing, jobs like construction workers and maids and hairdressers. Like those jobs don't come with health insurance, but they're still working, 40 plus hours a week. So these are like working individuals and they just don't have insurance access through the traditional routes, and they're just not aware of what else is out there for them.
Yeah, I think we all have friends or members of our congregation who are in that hole, and certainly feel for them, and certainly want to work for them. How different would it look? I know Texas is one of the few states that hasn't expanded Medicaid under the terms of the Affordable Care Act. How different would it look if we would have done that? And should Medicaid expansion be part of the committee's discussions during the interim?
Yeah, there was a lot of talk in the committee about how Medicaid expansion has been really costly for states that have done it. But I mean, if you're providing access to health insurance for individuals, of course it's going to cost more because they're finally accessing health care. And I mean, I'm kind of from the perspective of like, isn't that a good thing? Like, yes,
Yeah.
it's going to cost money, but isn't that the right thing to do? Like allowing people to see a doctor when they're injured or hurt or sick or just need to preventive care like vaccines. So yes, Medicaid expansion is the single most effective policy lever at getting insurance for those people that we call in the insurance gap. It's like they're just above that poverty line, but they're kind of below like the subsidies on the marketplace. And I mean, it would easily cover over 500,000 individuals if we just enacted that one policy. So to me, I think that's very effective and necessary. If we really want to tackle the uninsured rate, there's not going to be one solution. It needs to be an array of options. And I think Medicaid expansion has to be one of those options that we're willing to do.
We agree, and certainly something we've worked on for a long time. But besides that, what else do you hope comes out of the committee's work?
I think it's great that the Senate is interested in our uninsured rate. We have the largest uninsured rate in the nation. It's double the national average. I mean, it's a huge issue and it affects our healthcare systems in a number of ways. And I know if you live in rural Texas or have been through rural Texas, you have seen kind of the downtrending, hospitals closing or wings of hospitals closing just because they can't remain open. And all of that goes back to our uninsured rate. Like individuals that don't have insurance, they're putting off care until it's an emergency and coming to the ER. And then it's really costly. And all of that affects our entire healthcare system, right? So it affects all of us. So I am encouraged that they are interested in finally looking at like, who is the uninsured and why are they uninsured and how do we tackle that? I think that's a great conversation. I hope that they are ultimately open to an array of options and not just one. I think it's easy to forget, before the Affordable Care Act, we had a lot of kind of what they called like junk health plans where you thought you had insurance and you were paying a monthly fee, but then if anything happened, you would find out it wasn't full coverage. And so I think we need to be really careful about trying to bring back those options. I think we need to be very careful of what we're offering and that people know what they're paying for. We don't want to undo a lot of the work that kind of the Affordable Care Act implemented for our nation. And so I do think it's important for people to have coverage, but I think we need to really be focused on like full health insurance coverage.
Right. I know one of the other topics that Texans Care for Children has talked a lot about is the high number of children who are eligible but not enrolled in CHIP or Medicaid. Why is that such a problem in Texas, and what can the state do to address that?
Yeah, I mean, we have estimates are like around 400,000 kids are actually eligible for Medicaid and CHIP and just aren't enrolled. Like that's huge.
That's a lot.
It's almost half of it. Yeah. And so I think there's a lot of outreach that could be done to these families. A lot of these families are, in crisis mode. And a lot of them are on SNAP, which is like our food stamp program, but aren't on Medicaid. And so, I mean, there are a lot of opportunities for our Medicaid agency to use that information that they already have on file and then to do proactive outreach to those families. Because if you think about it from the perspective of like, you're in such a crisis situation that you're worried about feeding your family, you're not thinking about health insurance, right? You're just literally trying to get food on the table for your kids. You're like one step at a time. But if HHSC could outreach to you and say, hey, it looks like based on the income you provided us, you're also eligible for this health insurance. Would you like to get that? I think that would increase substantially the number of these kids that were enrolled. There's also a lot of fear because we know that there's a lot of mixed status families in our state, right? Like the child is a citizen, but maybe there's a family member that doesn't have legal status. And so there's a lot of fear in those families of providing that information to the agency and opening themselves up to like investigations and stuff like that. So I do think there's an education component that we could be doing a lot better.
I know this kind of ties in, but last year when you were on the program, you talked about the harm that Medicaid unwinding would do. How much of an impact does unwinding have on this? How bad was it? And what can local congregations or folks do to help mitigate the harm?
Yeah, so we knew the unwinding wasn't going to go well, and unfortunately, that's true. Texas is not unique in that. Like, if you look nationally, kind of a lot of states had a really hard time. It was a really big task, and they tried to do it quickly, which didn't allow them time to course correct. And so, I mean, the goal was to, get as many kids off Medicaid as quickly as possible. I mean, and that's what we did. Unfortunately, I think a lot of those individuals are still eligible, and now we have this huge backlog of applications because, to HHSC's credit, they have staffed up. They have a 97% retention rate in their eligibility staff, which they have never had. Wow. I mean, that is historic. So like they're doing something right there. But despite having historic worker retention, we still have had over 200,000 Medicaid applications in the backlog since January. And that means like somebody filled out the application, they provided all the information they needed, and they're just waiting for 3-4 months just for a worker to be able to touch that application. So, that's really hard because a lot of times you're not applying for insurance when you're healthy. It's like something's come up.
Right.
And so then you're looking for your health insurance options. And so that means, people are potentially sick and putting off care because they're just waiting for that application to get processed. So one of the things I've been telling even my congregation too, I know there's a lot of congregations that are community partners, which help individuals kind of access and navigate that complex benefit system is, if you have somebody that has been waiting forever and can't get any information on their application, there is a website update, an email address, update@hhs.texas.gov, and you can email that. It goes specifically to an eligibility worker. And if you include the case information and say, this individual has been waiting X number of days, can you please provide a status update? That should expedite the process significantly. So I've been trying to share that information as much as possible. Additionally, we're really concerned about our pregnant women that have become pregnant. So now they're eligible for Medicaid, but they're just waiting 3+ months to get their application processed. Like, that's not okay. You're already halfway through your pregnancy, probably by the time they're going to get to it. So I've really been encouraging people, if you are working with somebody that is pregnant, please send that information to that email address and include that it's for a pregnant individual so they can expedite that application. I just think they're trying really hard, but there are a lot of system limitations on their end. And so helping people kind of navigate this escalation process, I think, could help a lot.
I want to come back to the advocacy piece in a second, but you did mention the work that congregations can do to walk with families, to walk with people in their community. Any other advice you can give on what you hope congregations or people will do in their local communities?
Yeah, I think one of the hardest things too, and I see this when I visit, locations that are helping individual navigate, is like when you need all the things, it's hard to keep going when you encounter a barrier, like in that, because that one little barrier can feel insurmountable. And so I think one of the best things, and I've seen it too in our congregation in the way that they walk alongside people, is like just the encouragement and like doing it with them and holding them accountable. It's like, you know what? No, I'm going to bring you to my house. We're going to sit down and walk through this until we get you in. Or I'm going to make sure you're hooked up to somebody and you have an appointment set, and I'm going to make sure you get there. I really think like that hand holding is sometimes, it takes more from us, right? But it's like what makes the biggest difference for families, especially just when you're in a crisis situation. You can't think about that stuff. And sometimes if somebody says, I don't have an appointment until Thursday, like that feels forever away. And so just like offering to help and seeing the need and then like trying to fill it. It's really the best thing we could do.
Yeah, that's a good word. I appreciate that. A lot of this, though, is going to require policy change or advocacy efforts. we have listeners who are always asking for homework. What do you want us to do? Who should we talk to? So what would you say to them?
Yeah.
Where should our advocacy efforts be pointed right now?
Yes. So if you are interested in being involved in, contacting your legislator, that is always helpful. One of the things that we're really pushing for this session, and I think HHSC is going to be asking for it too, is like, we really need some investment to upgrade our outdated technology systems and really streamline these data-driven processes. A lot of states do this so much better than we do. And it could make it, I think there's a lot of unintended barriers in the way it's set up just because the technology is so old. It's like over a decade old. And if you think about your cell phone you had a decade ago, it can't do anything like what your phone can do today, right? You may not have even had a phone a decade ago. And so it's time for us as a state to invest in that infrastructure and to make it more flexible and user-friendly, honestly. So if you can contact your legislator, tell them that they need to invest in updating the eligibility system with HHSC, that would be really helpful. Another thing that we're promoting is this bill that we had last session. It's called Express Lane Eligibility. It got out of the House. It has bipartisan support. It just really got stuck in the Senate, and it was really political games at that point in session. And so we're hopeful that this bill could make it this time. But what Express Lane Eligibility does is essentially it allows HHSC to use data, like if you had applied for SNAP, to see that you're eligible for health insurance and then do that outreach piece to the individual and say, hey, based on this information we already have that you gave us for this other thing, it looks like you're eligible for health insurance. Would you like to apply? And I think the estimate that they put on that bill last session was that it would, lead to 100,000 more kids getting health insurance. I think that's huge. So yeah, as we're getting closer to session, we'll have, some more opportunities for people to get involved in that. But yes, Express Lane Eligibility, that's what we want past this session.
Express Lane Eligibility, 100,000 kids. Any guesses on how many people might receive coverage if they were to update the technology?
That's a really good question.
I love asking good questions.
We are trying to work on, kind of like streamlining what that would be. But I do think it would. One of the main things I hear from families is like, once they can get on Medicaid and CHIP, it's great. They have access to doctors. Yeah. They can get their medications filled. It's just that getting on it and the renewal piece that is so hard. And a lot of them give up because it's just too complicated. So, it's hard to measure what doesn't exist, but I think we will hopefully have a better number for you as we get closer to that.
Just curious. All right, friends. So it sounds like we have some homework. This should be common sense, right? Like, people of faith care about kids getting health insurance, and if they're eligible and they qualify, we should make that as easy as possible. So let's do some work to see if we can get that cleaned up and fixed. Diane, any closing thoughts or shameless plugs you'd like to leave with us today?
If you are interested in following along with the things that we're working on, Texans Care for Children, our website, we're updating it. It's going to be brand new in June. You can sign up for our kind of emails on there, and if you want to stay, in the know on what's happening.
Love that. Well, I appreciate the conversation today. Thanks for all of the work you're doing every day on behalf of Texas and especially Texas kids. And I guess I'll look forward to seeing you again on the podcast next May. We've got an agreement there. Really do appreciate you, though. Thanks for taking the time.
Yeah, see you then.
All right. I hope you enjoyed this week's conversation with Diana, and I hope you'll engage the interim charges over the coming months. We plan to talk more about that and the upcoming runoff elections in a coming episode. If you are in one of those areas with the runoff election, I hope you're encouraging your friends and congregations to vote. These elections are critical. Remember, turnout will be low, so your vote and efforts count even more. Check out Texas Impact's Texas Faith Votes campaign for resources on ways to engage your community in this election and the general election in November. For those resources and so much more, check out texasimpact.org. While you're there, I hope you'll take a moment to sign up to be a member of Texas Impact. Your membership supports this podcast and all of the work to engage Texans of faith to advocate for a more just and equitable Texas. If you have questions about any of it, please reach out. You can reach me at scott@texasimpact.org. And with that, I think it's time to close out this episode, so remember, The world needs Texans of faith active and engaged. So let's get to work.
Weekly Witness is hosted by Scott Atnet, engineered and produced by David Fasalo. Our executive producer is B. Moorhead. The opinions expressed on Weekly Witness are those of Texas Impact and our guests, and do not necessarily reflect the views of our sponsors. Weekly Witness is a product of Texas Impact, people of faith working for justice. Visit us online at texasimpact.org.